Okay, so again, my name is Cascade Tuholske. I'm an assistant professor of human environment geography at Montana State University, and I'm grateful for you all to be here today. This webinar is part of a welcome funded project called Building a Climate Cohort to Monitor Health Impacts of Climate Change in Ghana, led by Montana State University, Columbia University. Um, as well as Kintampo Health Research Center and participating health research centers in Ghana. Today, our speaker is Edmund. Pardon me? All right. I'll continue. Today, we are lucky to have a speaker, Dr. Edmund Yamba, who is a senior lecturer and research scientist in the Department of Meteorology and Climate Scientists at KNUST Ghana, where he also serves as an examination officer and postgraduate studies coordinator. He holds bachelor's and master's degrees from KNUST and a PhD in meteorology and climate science from the University of Cologne in Germany. His multidisciplinary research focuses on climate change, human health, and infectious disease modeling. Dr. Yamba is a co-investigator on several projects using artificial intelligence, mobile health, and cohort studies to tackle public health and climate challenges. He is passionate about mentorship, collaboration, and impact scientific research. So with that, I will pass everything over to Dr. Yamba. Thank you.
All right, thank you very much, Cascade. Let me share my screen. All right, so if you can see my screen,
Yes, it looks good.
perfect. All right, so thank you once again, Cascade, and then also thanks goes to all the organizers for giving me the opportunity to give you a little bit of talk on malaria transmission seasonality, and especially looking at climate drivers and some predictive models for Africa. And as Cascade mentioned, my name is Edmund, and I work with the KNUST Department of Meteorology and Climate Science. So for my talk, I will begin with just giving some small background on malaria prevalence and burden across Africa, especially sub-Saharan Africa. And then I also talk about some environmental and climate factors that drives malaria transmission, and then zoom into the predictive modeling. And then with the modeling, I will look at some simple climate models that we can use for prediction, and then also give an example of an advanced form of the modeling. And then I'll summarize my talk, and that will be it for the day. So as we know, malaria is a serious public health issue, and Africa carries the highest burden. And we understand that if you look at some of the factors that drive the transmission across Africa, we understand that from research that Africa is dominated by competent malaria vectors. And so because of this presence of these vectors, at least we have high malaria burden. The other factor that we see is about the suitability of the climate for those vectors to be able to thrive well. And what we see lately is anthropogenic climate change. And because of the changing climate, especially due to anthropogenic activities, it's further enhancing the suitability of landscapes for mosquitoes to be able to survive very well. And so these are the issues that Africa grapples with, and this might be just some few reasons why you have high malaria burden across the country. Of course, there are other issues like socioeconomic status, or that could be driving the transmission. What are some of the key climatic drivers? So from research, we understand the temperature, rainfall, relative humidity are very key when it comes to malaria transmission. And besides that, topography, population density are all factors. If you take rainfall, for example, we understand that rainfall provides the environment for breeding, and then also it has an impact on relative humidity. So for mosquitoes to be able to survive, they need at least a relative humidity of about 60% and or more for it to be able to survive. So you have rainfall contributing to breeding, and then also providing the influencing the relative humidity that help the mosquitoes to survive. Temperature, in a way, has a serious impact on the physiological process of the mosquito. So in terms of development, right from the larva stage to the adult stage, temperature has that kind of influence. And in these particular examples, for example, what you see here is about how temperature is playing a key role in mosquitoes or malaria transmission. So for example, there's research evidence that shows that malaria transmission is possible between when temperatures are between 16 degrees to 40 degrees. And because when temperatures below 16 degrees, the malaria parasite is not able to survive below 16 degrees. And temperatures above 40 degrees, even from like 30, mosquitoes undergo what we call heat stress. And at temperatures of 40 and above, they actually die out. So you have temperature influencing malaria transmission, and then you have optimum temperatures always falling between 21 to about 27 degrees. So again, if you look at Africa, you see that our temperature ranges are always between 20 and the 30s. You never have, it's quite not often to have temperatures below 16 degrees in most parts of Africa. And this is also another reason that explains why you would have malaria transmission high, because these are good for mosquitoes to be able to survive very well. The other aspect is the rainfall. So again, as I mentioned earlier, you have rainfall and surface hydrology. So rainfall will provide a breeding ground. You also have like other surface hydrology bodies like rivers, dams, pools, and all of these things provide grounds for which mosquitoes will breed. And that is why you find mosquito populations always higher during the rainy season and quite less or even mosquitoes going into hibernation during the dry season. So here is an example just to demonstrate how climate is the climate factors that drives malaria transmission. And the figure you see here is trying to show a pairwise comparison between rainfall, maximum temperature, minimum average temperature, and that of the EIR. The EIR here is the entomological inoculation rate. And this is talking about the number of infectious mosquito bites that people receive per day. Now, this data you see here are observed data. So these were data that we got from observations where they actually calculated this entomological inoculation rate. And then we tried to compare just to see at what ranges do we have ranges of temperature or rainfall, do we see infectious bites high or low? And we did that for different parts of Africa. And so you can see we have like the Sahel, which is mostly like the extreme part of the northern of Africa. Then we have the mid portions, which is like the Guinea Savannah zones. Then we have like East Africa and some parts of the Western Central Africa. So if you look at this, you see that in the Sahel, for example, you see infectious bites always falling between 20 and 40. And you can see that like as temperatures goes beyond 40, we usually don't record, you don't see infectious bites above 40 degrees. And even at temperatures that above 30 or 40, you can only see in most cases, the EIR values are quite low. But the most important thing is that you find the temperature ranges between 20 and 40 or 30. And hardly do we see any record below 15 or 16 degrees. And that again confirms the idea that temperatures below 16 degrees or so, you don't have malaria. Malaria transmission is not possible. Here is also another example that shows the relative contribution of climate factors in predicting the entomological inoculation rate. And again, for the same location, so you have Sahel, you have Guinea, the Guinea Savannah areas of Africa, and then Eastern Africa. And I just explained that using the Sahel alone. So when you see this, these are some modeling which we did with using the R. So there's an R package, and we call it that relative importance. And where with this relative importance approach, you are trying to see, you pick each of the climate variables, how do they predict the occurrence of infectious mosquito bites? So we look at that in terms of their collective prediction and then their individual prediction. So the very first part is the calculation of the coefficient R square. And we can see that for the Sahel, we have about 30%, which means that if you take rainfall temperature, minimum temperature mean, they contributed to together 30% of the infectious bites, which means that other factors are responsible for the other 70% of the infectious bite. But then when you look at them individually, I use two approaches. One is the linear modeling, and then we also have another approach, which you call it the first. So the LMG here is looking at, I pick one rainfall and see how rainfall contributed to the prediction in cognizance with other, taking there in recognition of other variables. But when you look at the other method, we are looking at it from the fact that it is ignorant of other factors. So with the LMG, we can see rainfall contributed 7%. You see maximum temperature contributing 12%, minimum 4%, and mean average temperature about 6%. When you look at the contribution with each variable being ignorant of others, you see rainfall alone is contributing 15% and maximum temperature contributing about 17%. So the idea here, again, if we look at the p-values, you can see that the p-values are quite pretty significant. So the idea of this example is also just to show that climate variables play a key role in driving malaria transmission. So having understood that malaria climate variables have play a role, then we may have to see how we may introduce predictive modeling and trying to operationally include climate variables in predicting malaria. But one reason why we will want to go for the predictive modeling is because if you look at malaria surveillance especially in Africa, I will say that it's quite weak. And the reason is that if you look at most of the cases that we get, they are usually based on manual case definitions or suspicion by clinicians or counting of malaria cases in a way. And when you look at the approaches that are used for the surveillance, the system, in my opinion, works very well in cities with very good health care. But if you go to rural areas where healthcare is purely bad, these kind of methods, diagnoses that are done in the cities might not work very well, and which means that the data we might be gathering from the rural areas will not be as good as we will get from the cities. So, and most of the malaria cases that we also get, it also comes with some form of drawbacks. So we understand that sometimes they use their rapid RDTs to be able to diagnose malaria. And sometimes most of these RDTs comes with their with their errors. Sometimes they give good results, sometimes they don't also give good results. So combining all these things, we might have some challenges. Looking at all these challenges, maybe it is important that we can see how we bring in predictive modeling to be able to help the situation. And the other issues with the malaria cases has to do with the varying health-seeking behavior, because then people decide where they want to go. Some other also decide they don't even go for health checks at all. And most of the cases that we also gathered that are gathered, you might not have all the cases coming from one particular location. So if we want to bring in predictive modeling, we should be able to incorporate climate variables, and then we can be able to simulate cases like vector survival. So we can tell, and based on climate, how long are mosquitoes able to survive? We can also look at extrinsic incubation period, and this has to do with the time domain that the parasite takes to be able to develop in the mosquito into a full parasite. We can also look at vector density. We can look at the EIR again, which I spoke earlier on. And these are metrics or indices that we can spatially, we can simulate them and produce like geospatial maps. And then based on these particular maps, we can tell where cases are much more prevalent, or malaria is much more prevalent. And so we can target vector control measures. So here are just some suggested simple suitable climate models that we can use. And one, we can look at, if you want to look at vectorial capacity, which has to do with the ability of the mosquitoes to be able to transmit malaria, you can just use a simple equation like I've shown in equation 1, as you see here. And maybe for the sake of time, I will not go into details of all the parameters that are involved here. And then you can also use another model, like, and again, when you look at the vectorial capacity, it incorporates what we call the survival probability, and then also the extrinsic incubation period. And the survival probability can be determined using equation 2. If you look at the survival probability, it incorporates the T you see there is the temperature. And this is the temperature the mosquitoes experience. So it could be like a diurnal temperature, or if you want to use like average temperature, you can also use that. And these are the temperature the mosquitoes experience daily. So you can actually use this particular model to tell how temperature is influencing the survival of mosquitoes across the country. You also have the extrinsic incubation period, and which is, you can calculate that using equation 3. And all of that is also, the TI you see is also the temperature, again, the diurnal temperature. And then the TS has to do with the threshold temperature. So what threshold temperatures do mosquitoes survive? The parasites survive. And we already saw from my previous slides that temperatures above, below 16 degrees, mosquitoes don't, the parasite don't survive to be able to lead to any transmission. So you can use that threshold temperature and also use the diurnal temperature or the average temperature and be able to model how long the parasite will take to develop. And this is also important because when you are targeting elimination, you need to be able to tell how long a parasite can survive in the mosquito. And these models are able to help that. You can also have equation 4, which has to do with the frequency of mosquito bites. And again, in the model, you can also see TI and then TG. And these are all temperature functions that you can incorporate. And based on that, you can tell how is temperature influencing mosquito biting cycle. So these are simple models that we can use for that. So let's see, these are some parameters with the model, the equations that I've shown, and then that we can, that I got using some of the references that are shown here. So I'm just going to run you through some quick examples here. What you see here are the ages, in other words, the lifespan of mosquitoes. This is an average lifespan of mosquitoes across Ghana. And I've just made this map across the different regions of Ghana and looking at it per month. So which months do we have mosquitoes living longer, and which months do we have mosquitoes having shorter lifespan? And again, when you look at the months of February, March, April, May, you can see that the mosquitoes actually live very short. Their lifespan is very short, up to about 9 days or 10, depending on the month. But when you move out, that's like in the northern part. In the southern part, you can see especially this the extreme southwestern portions of the same months, February, March, April. You can see mosquitoes living up to about 11 days or 12. But when you move to the rainy season, which is June, July, August, September, especially August and September, you actually see mosquitoes living up to about 14 days. So again, um, these are all climate driven. So based on how temperature is influencing how long mosquitoes are able to live. And this kind of information is also important because then when you are targeting interventions, we can tell which areas are mosquitoes living longer, which areas they don't live longer. So it might in this scenario, for example, if you want to target intervention or target elimination, it should be nicer to target the elimination from the northern fringes of the country and move towards the southern part, because then the mosquitoes are short-lived. Their lifespan are kind of like shorter in the northern part. And so it's easy to deal with malaria in the fringes, northern fringes, and move towards the southern part of the country. This is also an example showing the extrinsic incubation period. And here is telling us how long the parasite will take to develop into a full parasite within the mosquito. And again, if you look at the months of March, April, May, the northern part, it takes shorter period. And then in the southern part, it takes longer period. Again, in the months of August, September, you have the longest periods occurring. And you can see that spatial distribution as well. But even though we see that parasite takes shorter time to develop in the months of March, April, also understand that the previous slide that I showed, mosquitoes also don't live longer in the northern parts in this part of in these months. So again, temperature may influence, make the parasite development shorter, but then they have a negative influence on the mosquito's life. So if the mosquitoes are not living longer, it means that the parasite development will also not be possible in a way. And so this is also just an example of the bacterial capacity and showing the ability to be able to, of the mosquitoes to be able to transmit. And we can see that the capacity is quite higher, especially in the rainy season and lesser in the dry season. So look at the months of January, February, and then December, November, December. So these are the dry season. And we can see the effects more pronounced in the northern part of the country compared to the southern part. What you see here is trying to see the extrinsic incubation period that I talked about, and then the lifespan. I was trying to see what are the trends of these variables right from 1990 all the way to 2023. And you can see that especially the lifespan of mosquitoes are decreasing. So it means that like from the 1991 all the way to 2023, we can see a downward decrease in how long mosquitoes are living. And what this means is pretty pointing to the warming, which means that in most parts of the Ghana, the temperatures are going higher. And because temperatures are increasing, the climate is warming, mosquitoes are also not living longer again. So maybe, who knows, if this continues, either it might become easy to be able to eliminate malaria, because then mosquitoes will not be able to live longer. Or it's also possible that these mosquitoes will be able to adjust and be able to adapt to the current climate, to the climate. And when this happens, then it means that most of our strategies will have to change, especially in terms of how we deal with malaria. Now, I also want to now, moving away from the simple climate models, I also want to give an example of how we can do the modeling using quite advanced method. And this has to do with using the vector malaria model. And what you see here is the architecture of the vector model. And this model is pioneered by the International Center for Theoretical Physics, ICTP. And in this model, we actually collaborated in the work. And what you see here is the model has an architecture where it takes care of the the larval stage of the mosquitoes. So it uses the surface hydrology. In other words, it takes care of the breeding grounds like rivers, ponds, streams, and what have you. And then it's able to tell how these larval stages, so mosquitoes lay eggs on these river bodies, and they're able to develop into larvae and pupa. And then from there, they're able to develop into the matured vector. And that's the vector stage that you see in the middle portion. So you have the larval stage, and it looks at how many days it's able to develop and moving from the larval stage. So the egg hatching, going through that cycle, and then into the vector. And then when the vector is now is developed into a full vector, it now looks for, you have that interaction where the vector looks for a human being or the host to be able to bite and take a blood meal. So you have that kind of interaction, this cycle of interaction. So from the larva to the vector, and then the adult vector now biting the human being and taking blood. And during the biting stages, the infected mosquitoes are able to transmit the parasite to the human beings. Now, within all these stages, you have the model taking in climate data, which is temperature, rainfall, and temperature and rainfall, and also demonstrating how these climate variables affect or influence the mosquito at the various stages, and also the parasite development in the mosquito at various stages. And all these things are mathematical differential equations that were developed and programmed using Fortran, and they're now kind of like simulated to be able to do the simulation. So what you see here is just an architecture, but behind the scenes, you have several equations that does this job to be able to give us do the simulations, which I didn't show any of them because I feel that maybe it might not be necessary. But then there's the publication is there, and this is Tompkins et al. In 2013, and there's a full publication. And if you want to look at all that went into the model, you can look for that particular paper and read. So the next thing I want to do is just showing you an example of how you can use this model to be able to simulate vector density. And what you see are monthly vector density across Ghana. So in January to December, if I look at the spatial distribution of vector density across Ghana, how does it look like? Which months do we see more vectors? Which months do we don't see more vectors? And what you see here is just the historical time frame. So we can see again that the dry season, for example, January, February, March, April, and then November, December, especially in most parts of the country, the vector density are quite very low. But from April, you see vector density increasing from the south and moving northwards. So you see from April, the development growing in May, and then by June, you see vectors population across all parts of the country, and with peak in July, and then August that way. Yeah. So you will see the rainy season showing that. But again, if you look at August and September, you see that the southern portions actually show low vector density. And this is the reason because the southern portions of the country has two rainy seasons. And August is more like a break. So you see a little dry season in August in the southern parts, whilst in the northern parts, you see the peak rainy season. So it's not surprising that you see August showing peak, showing much vector density very high. And then in the southern part, you see it very low, very low. And this is because of the break in the little dry season in the southern part. But it doesn't mean that vectors are completely absent, just that their numbers are very low. And then by October, you see them picking up again. The entire country would have picked up with the vectors again. The next example you see is, so this very first example was looking at the average, historical average. I did a simulation looking at what is the situation like in terms of vector density from 2031 to 2060. So what you see here, there are two things that we see. in the very first one, historical part, we see that vector densities were quite high. They can go as high as 4,000 per grid. And then the grid, in other words, the simulation we did were every 5 km. So within every 5 km boundary, you can see vector density going as far as 4,000. But in for the projections, you see that like the vector density has actually reduced. You see it reducing, getting down to about 3,000 per every 5 km grid, which means reducing. And the second thing you also see is that in August, we could see like a break. We could see vector density reducing in August, in the southern portions, both August and September. But for the projections, we don't see anything like that. You can see that the entire country, from June all the way to October, you see vector density high. What this means is that, one, with the reduction, it means that like temperatures also talks about the warming of the country, which means that the climate is warming. And again, I showed that the vector life, mosquitoes are not living longer because the temperatures were, the climate is warming, and so mosquitoes are short-lived. So we can see that the populations are also decreasing, especially in the future, also to suggest that temperatures, the climate of Ghana will further warm. And because it will further warm, the populations of mosquitoes population might reduce. Okay. We also see that August is not showing, is different in the future because which I didn't show here, rainfall patterns will actually reduce from, let's say, from the bimodal in the southern part to a unimodal rainfall season. And that is why we don't see any reduction in August. So the entire country is likely to become like, show only one single rainy season, both from the north and both in the south. Another example I want to show here is the malaria cases. So the model is able to simulate malaria cases per every 25-km grid. And what we see here, again, we see the peak cases much more higher in the rainy season. And we see a similar trend in terms of the vector density. So you see August, September, October showing low cases in the southern part, but high cases in the northern part. Because then in the northern part, these months are the peak rainy season in the northern part. And you see a break in the rainy season in August and slightly in September, in August in the southern part. And so you see cases going down. But what you see here is a future case. And just like I showed for the population density, you also see that the cases will become like, it will not show that bimodal transmission, but then you have like a unimodal transmission. And then you see malaria cases very high across July, August, October, and September, October. So in the future, by 2060, we should expect that mostly we should expect very low, either no transmission or extremely very low transmission in the months of January, February, March, April, and May and December, especially in the northern parts. And then you actually see transmission beginning to pick up in the northern part in June, and then going as high as in August and September. And then by November, you still see the southern part showing high cases, but then the northern part will begin to reduce, and you might not see any transmission in December or very low cases in December. So to summarize my presentation, we can actually use climate proxies to determine malaria thrivability, or even when you look at the vectors, to show how vectors are able to thrive across the country, and how that can also be used to help in terms of simulating malaria transmission, and how we can also target control measures. So at least we can, based on those climate simulations, we can actually operationally include climate information in the simulation. And once we're able to do that, we'll be able to create distribution maps or dashboards and using these key indices. And these indices can actually help in terms of or guide in decision making. So I feel that one thing we can do is that we need that kind of multidisciplinary collaboration. So maybe people in the public health or clinicians or statisticians, climate scientists, at least we can actually come together and merge our expertise. And merging this expertise, we'll be able to fight malaria. And it's not only malaria, but then other mosquito-borne diseases or any of the infectious diseases. So these are just some of the references, and thank you very much for your time, and I welcome questions.
Fantastic presentation. Really appreciate you taking the time to put together such a thorough talk. So now we will open it up to questions. I believe if you raise your hand, we'll be able to ask a question with your audio. Otherwise, if you have a question, please put it in the chat. I also have many questions as moderator to ask, but I'd like to open it up to the audience. Thank you again.
So there's a hand raised from Desmond Close. So.
Okay. Solomon, Desmond, go ahead.
Okay, thank you very much for the wonderful presentation. My name is Desmond Klu. I'm a senior research fellow at the Center for Malaria Research at the University of Health and Allied Sciences in Ghana. My question is that the National Malaria Elimination Program has developed a strategy to eliminate malaria, and one of that is that they've stratify the countries into zones. So we have a very low bedding areas, moderate and high bedding. So for the low bedding, they are putting much of interventions. So 21 districts in Greater Accra has been earmarked for elimination. I want to ask, these predictive models using climate drivers and all that, can it be applied as in those areas, let's say low bedding, so that whilst we put in efforts to do vector control and other to prevent infections and all that, can these models be done at that lower level, the district level, in terms of surveillance, or it can only predict at the national level? That's my question. Thank you.
All right. Yeah. So thank you very much for the question. Yes. So the answer is yes. It can be done. All we need is just taking climate information from those districts. So whichever districts they are, we will need just the rainfall for those areas, temperature, it can be minimum, maximum temperature. And then we can also take like the population density for each of those districts. And then we will be able to simulate these interventions, the indices that I've showed for each of those districts. So it's possible, it can be done, and and it's quite easy to do that. You can do that looking at the historical situation. So we can take past data and look at how these indices have evolved in the past. And then we can also use projected data and do the simulations look at it for future projections for these same districts. And for me, the future projections will be much important for malaria elimination program, because the ones you want to use your interventions, you need to know maybe in the next month, what will vector density look like for those districts? What will entomological inoculation rate looks like for those districts? What will, how long will these vectors be able to survive? So maybe in the next month, or in about 2 months or 3 months, or in a year's time, what will their lifespan look like? So I think that we can actually do these things for the National Malaria Elimination Program. And then based on these indices, it can help them target interventions. Thank you.
Thank you.
Thank you, Desmond and Edmund. Jonathan, I saw your hand was up, but you've taken it down. But if you still have a question, please raise your hand again. Otherwise, oh, it looks like you put it in the chat. So the comment from Jonathan is, I was going to raise a similar concern on how the predictive model data can augment that from NMEP for the purposes of policy formulation and implementation. So thank you for that comment. Now we have another question from Clinton in the chat. The question is, my question is about how to measure or predict climate change in extreme weather conditions. Could this help with some models or approaches? Thank you. And he's referring to models to predict or measure the impact of climate change on extreme weather conditions, specifically temperature. Over to you, Dr. Yamba.
Yes, so again, we can have like models to be able to do that as well. One example is the vector model that I talked about. And these models just use like, again, their input parameters are just basically climate variables. We already have like projected climate information. And so you can actually synthesize and see what are the climate projections? Do we have like floods? Do we have high temperatures? And based on those projections, which can actually tell how climate change is going to influence the transmission. So yes, vector model can do that. And if you don't want to use vector model, you could also use those climate projections and use the simple models that I've shown. Or if you want to rely on other models as well, that's also possible. You can do that.
Thank you, Edmund. And I'm going to take the opportunity to ask a question as somebody who's starting to work with climate models and environmental epidemiology more. When you say we have climate models, are you talking about climate models that have been downscaled specifically for Ghana? Because it looked like the spatial resolution of your projection was quite high, and I'm curious if you could speak to those.
Yes. So this particular example that I did for this presentation, I actually took data from I use data. I downscaled the data from RFI, from CHEPS, and then I was actually using an example that was looking at spatial resolution of 0.25 by 0.25. So this is more like a 24-kilometer grid, slightly more than 25. So that will be around 30 kilometers. Yeah. So at least you can see that the spatial resolutions were quite higher, but we also have like data products that are highly resolved. So if I have like every 5 kilometer, or I have like something less than that, or even a 1 kilometer, you can actually do the modeling around that. So what I did was for these particular examples were using data that had a little bit of high resolution, and that's why you see those spatial resolutions looking higher.
So if I'm understanding correctly, you use the CMIT6 outputs and then downscaled them using Arrow5?
No, so I didn't use SMIT6 for the historical data. For rainfall, I use CHEPS, and then for temperature, I use Arrow5. So all of them have like 0.25 by 0.25 grid spacing. For the projections, I use the Codex data. I don't know whether you are familiar with the Codex project. And the Codex project, I think it's an upgrade of the SMIT6. I think from the Codex, they now have the SMIT6 from SMIT5 to SMIT6 project. So I use the Codex data, which I downloaded quickly and did the simulations for the presentation. And for that Codex data, you have for the African domain, it also, the spatial resolution is about 0.25, no, 0.22, thereabouts. Okay, so again, if you want to look at the grid box, you should have about, say, 25 to 30 kilometer boundary.
Excellent. Thank you for sharing. I'm going to pass it off to Darby Jack. Go ahead, Darby.
This is so interesting. Thank you, Edmund. Really strong work. My question is about other sort of mediating variables, and I'm specifically thinking about hydrology. And for some locations, rainfall will result in standing water. In other locations, the hydrology is such that rainfall will immediately be absorbed. Is that something that this modeling framework, if you had a data layer that captured key aspects of hydrology for the whole country or for a region, is that something you can accommodate in this modeling framework?
Yes. So the the simple models that I showed initially, these ones does not actually include, it doesn't make do of the hydrology. So when you have like surface hydrology, so when I have like breeding grounds and that kind of stuff, these particular ones will not help that much. But at least it can just give you an idea of how, let's say, temperature or rainfall can have like an influence. But the one that helps so much is the vector model. And the vector model has like a whole section that is dedicated to hydrology. And this was actually tested by a number of PhD students in ICTP. And then they built a model trying to utilize this surface hydrology. So for places where you have like rainfall, breeding grounds like rivers or dams or streams, the model actually takes care of all of that. And then they also try to do what we call for each of those breeding grounds, they try to test what the water temperature will look like and how those water temperature can influence the development rate of the larvae of the mosquito, the water-bound stages of the mosquito. Then it also takes care of issues with flooding, so flooding and droughts. So in the event that you have like heavy rainfall, such as the peak rainy season, you can have like those water breeding grounds flooding. So once it gets flooding, there's a modeling, there's a factor that takes of how flooding can actually flush out some of these water-bound stages in those ponds or in those pools. And then you also have the case where in the event that there are droughts, how some of the water bodies might even aid in become more breeding, aid in the breeding side. Or even if they were flooding, the aftermath of the flooding, some of the flooded water can also gather elsewhere and become like breeding ground. So all these things I'm trying to say is that this particular model takes care of the question that you have asked. And so when you want to use this model, the important thing is trying to adapt, reparameterize the model to adapt to your climate. So in the case of Ghana, we need the climate data from Ghana. We also need the entomology of data from Ghana and also the population density. And then parameterize this model to suit the climate or the area that you want to work with. And then you can run where they use the satellite images to be able to identify some of these breeding grounds. So if you have like a breeding ground, there's also already, and this is something that they are currently working on, and using that technology to be able to identify breeding grounds and see how they loop that into the model, like to be able to do the simulation. So yes, I know that data is available, but with the ICTP group. So. Thank you.
Thank you so much. We have another question in the chat. Hi, Edmund. Did you consider temperature variability in your modeling framework, and do you think temperature variability may better explain the rates in different environmental conditions?
Yeah, so the temperature variability in this case, yes, it's taken care of because the simulations are done daily. So you are using the daily temperature to do the simulation. So you can see every day's cases. And we know that temperature varies every day. And so that variability you can already see that per day. You can already see that. So the variability is taken care of using the daily simulation. Even if you want to do like an hourly simulation, you can also do that because we have data available on an hourly time scale across like a number of years. So you can do that simulation, and then you can see how the variability has an influence.
Thank you for
Thank
that.
you.
Another question from Desmond Clue.
Yes. Okay, Dr. Yamba, I want to know is it possible for you to create an index taking into consideration the rainfall mean and max or minimum temperature, creating an index for these two climate variables to predict malaria and other things? Is that possible?
Let me get you clear. If you say an index, that index, what do you mean?
So, because of issues of, temperature and rainfall, both having and predicting malaria, I was thinking if those values, temperature values, rainfall values, you can pull them together and have an index that, okay, if a minimum change in temperature could affect something like a rainfall patterns or something like that. That's why I'm asking whether it is possible to pull those two together and use it as a like more of interact the temperature and the rainfall
Okay,
figures. Yeah.
right. I think I get that. So you can, we can actually do that. And if you look at the slide that I'm showing, the equation 1, for example, it incorporates both temperature and rainfall and telling the vectorial capacity. Here, I define it as the vectorial capacity, and we can actually use this to create the index that you are talking about, where it incorporates both rainfall and temperature and then telling how that will influence the vectorial capacity. In fact, this can actually also be similar to disease transmission, what we call them the R naught and which is also like an index. So you can the R naught, which talks about the number of secondary infections that you get from a particular infection. So we can actually build this particular index around that and this equation around that and develop that index and be able to use that. The modeling, so I'm showing this one too also because this particular one, which is quite sophisticated, includes the interaction of all the climate variables. So you have minimum, maximum temperature, you have relative humidity, you also have this surface hydrology that we talked about. Yeah, and then you have the population density, because then mosquitoes are biting from one person to another. And places with high population density, you are likely to have low infectious biting rate compared to places where population densities are quite less. So yes, to answer your question, we can actually create that index and we can build the index around this particular equation that I showed you, the equation 1 here.
Yeah, that helps. Thank you.
Thank you both. Are there any remaining questions? I have one more with our last 4 minutes, but I don't want to hog the time. If anyone has a last question for Dr. Yamba. Okay, so here's my question. So my reading of projections for the broader African Sahel is that precipitation is projected to increase, and there will be more available moisture across most of the region. And so at the same time, temperatures are also projected to increase. And so I'm wondering if it would be possible to apply this to both the temperature moisture relationship for the survivability, rather than looking at the variables independently. And I'm just curious on your thoughts, to identify hotspots of change where malaria transmission may increase or decrease.
Yeah. Yeah, thank you, Cascade. So again, yeah, so I'm aware of those climate projections across Africa. And when you look at it, I think the literature I've come across is more like the examples I've given. You see that much more in the maybe eastern part of the Eastern Africa. And yeah, but I'm not too sure of the exact figures, but I know that in parts of Eastern Africa, you would have like precipitation increasing, and then maybe temperatures also increasing. I'm not sure is the same for West Africa, especially in western part of in West Africa. West Africa, you will see again temperatures are going up. Precipitation, I tried to do some analysis using Ghana data, and all the historical data that we see so far doesn't show any clear pattern in terms of precipitation across Ghana. So I haven't done like let's say a West African wide analysis. And the literature I've seen so far suggests that precipitation, some say that precipitation might decrease. You also have other literature also saying that precipitation will increase. But for this case of Ghana and what I have seen, there's no any clear pattern, in a clear precipitation pattern. And so it's quite difficult at the moment to be able to predict whether precipitation will increase or it will decrease. What I also saw, and as I showed in the presentation, is that we also saw that like for the projection of precipitation, you don't see again any clear trends, but in terms of bimodal seasonality or unimodal seasonality, the southern part of the country is likely going to move away from the two rainy season to one single rainy season. Okay, so you wouldn't have maybe rainfall slowing down in August and picking up again in September that way, but you just have like one single rainy season as compared to, as we see in the north. And then the northern parts might have some at least 1 or 2 months reduce in the precipitation cycle. But in terms of their trends, you don't actually see any clear trends. So maybe I can speak this way for Ghana, and these are some of the examples that I showed. But as you suggested, I can actually run this analysis and see what other parts of the country, sorry, Africa, looking at using their data that are available, and then see what these projections look like and how they can have an influence on malaria transmission. And based on that, we can tell which areas are likely to have hotspots and which areas might not, and how we can target elimination.
Well, we're right at time. Thank you for your thorough response to my final question. And we will be in touch about the next CLEAR webinar. And I just, again, thank everyone for being here. Please follow up with me or Dr. Yamba if you have any further questions. And with that, we will close out the session. Thank you, everyone.
Yeah.
Thank you.
Thank you.
Thank
And
you.
then
Great
just to
job,
say
Edmund.
that
Bye.
if anyone has any questions, you can always reach out to me and I'm available to address them.
Thank you. Goodbye.
Yeah, great.
Thanks,
Yeah.
everyone. Take care. Have a good day.
You too.